The CDC has now reversed its guidance on masks for vaccinated Americans amid a surge in new COVID cases. It comes 2 months after the CDC had advised that fully vaccinated people could stop wearing masks in most indoor settings. The agency now says vaccinated people who live in areas with substantial and high transmission rates should wear masks indoors in public spaces. The CDC is also urging universal masking for all teachers, staff members, and students in schools, regardless of vaccination status. Let's bring in ABC News medical contributor Dr. John Brownstein for more on this. Dr. Brownstein, what do you think? Are you surprised by this reversal?
No, I'm not. And the reason is that Delta has really changed the game. I know the American people are going to feel like whiplash, like, wait, you just said that masks, we can remove the mask if you're vaccinated. But that was really before Delta, right? So the vaccines are working, and we know that they're doing well to protect against what matters, hospitalizations and deaths. But there is emerging evidence of these breakthrough infections, and especially the opportunity for you to transmit if you're fully vaccinated. And so it's not really a backtracking by the CDC. It's evolving information. It's surveillance data. It's a recognition that we're seeing these surges in many parts of the country. And in order to contain these surges in these hotspots, you're going to need layers of protection. So vaccines is one, but it's going to be about masking. It's about social distancing, all these layers that are sort of coming back into play, unfortunately.
And as you say, Doctor, changing circumstances, so changing guidance. But as you also note, there's a lot of, weariness with it all. So how long do you think this new guidance is going to be in place?
Yeah, I can imagine most people are not keen to get this mask back on, especially if you've taken the steps to get vaccinated. I fully agree. I'm in that same camp as well. But, in order to get to the other end of this pandemic, we're going to have to do our part. Unfortunately, there's no sort of timetable. We could be well into the fall because, we may see surges in other parts of this country. The best guess is really until you can bring transmission down. And when you see the data that looks like, that transmission is down in communities, then you can remove that mask. And the key here is, do these policies actually translate into, policies that take place at the local level, and even more importantly, behaviors? Are we willing to make these sacrifices now to get to the end? And it's unclear to me if we can really get there.
Well, let's hope we pull together. But let me ask about the contagiousness of the Delta variant in vaccinated people. What does the research show on whether or not, since I've been vaccinated, you've been vaccinated, if we do come in contact with Delta, how infectious are we?
Yeah, I think this is emerging data, and there was some recent evidence that potentially your viral load, if you're vaccinated, could be similar to whether you're unvaccinated. That still needs to be clarified. But the reality is we are seeing more breakthrough infections. We are seeing more viral shedding. And this is different than the other coronaviruses, the other versions of this virus, where we didn't have this level of transmission. And that's why we're seeing this change in guidance. Clearly, we've got to keep reiterating the vaccinated people are not getting severe illness. They're not dying. And so we got to make sure people recognize that the vaccines are still our weapon to get out of this pandemic. But, these new variants, they are sort of challenging our ability to control just purely with a vaccine. And again, this is why masking is coming into play.
Now, over the past 7 days, the U.S. is averaging about 40,000 new COVID cases a day. Is there any read on how high that number can get, given the number of people already vaccinated in this country?
This is where, these models, are challenging. They're guides, but, we want to be careful about overcalling things. We know so many times through this pandemic, models have been wrong, but some really good models that have brought together different information streams have shown that we could keep seeing this surge well into the fall. And that's concerning. You could potentially triple the numbers of daily deaths. So we're about 200 now, go up to 600. But, these models don't account for the fact that people are changing their behaviors. We're already seeing increased vaccinations in the South because people are seeing their loved ones or people in the community that are getting severely ill. So we can change this course. It can get very bad, but we also have the opportunity to shift the course of this pandemic by doing what it takes right now. But, seeing some hopeful signs that people are starting to take this seriously.
Now, the FDA is asking Pfizer and Madonna to expand testing in young children to learn more about potential side effects of the vaccine for that age group. What's the latest on that?
Yeah, so I think this is, not to try to create fear for people. This is just about the FDA really doing its job to making sure that they're collecting as much safety data ahead of trying to approve this vaccine in younger kids. We know that there's this concern about this rare inflammatory disorder among, especially in boys. And so they want as much data. They want as big a database as possible to make sure they fully understand the risks. Clearly, we believe generally that the risks of the vaccine are really outweighed by the benefits of these vaccines. And so, I think that generally what we'll see is these vaccines approved, but, there's a lot of hesitancy around vaccinated younger kids. We know that the risk profile is different. Kids can get severely ill, but for the most part, handle COVID pretty well. So as parents make this decision, they're going to want as much data as possible. So expanding that safety profile, fully understanding these vaccines are safe is going to be so key to making sure we can have an effective rollout in our kids.
All right, Dr. Brownstein, always great to have you. Thank you.
Thanks so much.
Thanks, Yuan.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.